Hey everyone, and welcome back to the channel. Today, we're going to talk about something really important for men's health, something that often gets overlooked or misunderstood, the PSA test. You've probably heard the term, but what does it actually mean? Why is it important? And who should be getting it? Stick around, because we're breaking it all down in a simple, easy to understand way. First things first, what is PSA? PSA stands for prostate-specific antigen. It's a protein produced by cells in the prostate gland. The prostate is a small gland, about the size of a walnut, that sits just below the bladder in men. Its main job is to produce some of the fluid that makes up semen. Now, a PSA test is a simple blood test. A small sample of your blood is taken and sent to a lab to measure the amount of PSA circulating in your bloodstream. It's normal for a small amount of PSA to be in your blood, but certain prostate conditions can cause those levels to rise. So why is this test so significant? Well, a high PSA level can sometimes be an early indicator of prostate cancer. And when it comes to cancer, early detection is absolutely key. Finding it early, when it's still confined to the prostate gland, gives you the best possible chance for successful treatment. But here's a crucial point. A high PSA level does not automatically mean you have cancer. It's not a definitive diagnosis, but rather a red flag that suggests something might be going on with your prostate and that further investigation is needed. What else can cause high PSA levels? Several things, actually. And one common cause is a condition called benign prostatic hyperplasia, or BPH. This is just a fancy way of saying an enlarged prostate, which is very common as men get older. Another cause can be prostatitis, which is an inflammation or infection of the prostate gland. Even recent activities, like vigorous exercise or certain medical procedures, can temporarily raise your PSA levels. This is why the PSA test is part of a larger conversation you should have with your doctor. It's not a standalone answer. Your doctor will look at your PSA result in the context of your overall health, your age, your family history, and other risk factors. If your level is elevated, they won't just jump to conclusions. They might suggest monitoring your PSA levels over time to see if there's a trend, or they might recommend other tests, like a digital rectal exam, an MRI, or in some cases, a biopsy to get a clearer picture. So who should be thinking about this? General guidelines often suggest that men start having this conversation with their doctor around age 50. However, if you have a higher risk, you might need to start earlier, maybe around age 40 or 45. What puts you at higher risk? Well, having a close relative, like a father or brother, who had prostate cancer, especially at a young age, is a major factor. The decision to get a PSA test is a personal one, and it's best made in partnership with your healthcare provider. They can help you weigh the potential benefits of early detection against the potential downsides, like the stress of a false positive or the side effects of further testing and treatment. It's all about making an informed choice that's right for you. To sum it up, the PSA test is a valuable tool for monitoring prostate health. It's a simple blood test that can help detect potential problems early. An elevated level isn't a diagnosis, but it is a signal to talk to your doctor and figure out the next steps. Don't be afraid to bring it up at your next checkup. Being proactive about your health is one of the best things you can do for yourself and your loved ones. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more health content. Stay safe, stay informed, and we'll see you in the next video.